Imagine the center of your vision disappearing, so you can only see out of your peripheral vision. That scary thought is a reality for people with a pretty common eye condition called age-related macular degeneration, or AMD. I'll cover how AMD impacts your vision, how to treat it, and even some simple tips that significantly reduce your risk of ever getting this. AMD is the leading cause of vision loss and even blindness in people over the age of 65. Approximately 1 in 10 Americans over 50 have the early form of AMD, while 1 out of every 100 Americans over 50 has the vision-threatening late form of AMD. Usually, people don't get AMD until after the age of 50, but people have been known to develop it as young as in their 30s. This is a condition of the retina, which is the back surface of your eye containing all of your photosensors that convert light into electrical signals that your brain can understand. One of the first symptoms of AMD that people notice is night blindness, or trouble seeing in low light. There are 2 kinds of AMD, the dry kind and the wet kind. Dry AMD is more common and is what 85% of people with AMD have. In the early stages of the dry kind, yellowish deposits of a protein called drusen form under the retina that can cause blurry vision and distortion of lines. More of these buildups means a more significant case of AMD. And in very advanced dry AMD, parts of the retina atrophy or die off, and then patients start getting permanent blank spots in their vision. Thankfully, dry AMD progresses really slowly, and catching it early lets you treat it using the methods I'll describe later. But if you have the wet kind of AMD, it develops a lot faster and your vision changes can be pretty severe. Wet AMD involves blood vessels growing through the back wall of the retina and into the eye where they leak blood. Yikes. When this starts to happen, patients' vision becomes warped or distorted. Eye doctors sometimes have people look at a grid of straight lines to pick up on the early stages of this warping. And this leaking blood into the eye damages the retina. In the later stages of wet AMD, patients may keep their peripheral vision, but the damage to their macula, the part of the retina responsible for the center of your field of view, causes the center of their vision to disappear. This messes with your life so much because the center of your vision is where your eyes try to focus on the things most important around you. When looking at the face of a friend or a family member, unfortunately, you might not be able to tell who they are. This would also make it really hard to read anything. The good news is that catching AMD early gives you the chance to stop it from getting worse. The sooner it's caught, the better the outcome of treatment will be. So definitely visit your eye doctor if you think you're having these symptoms. Special eye vitamins, like the ones labeled AREDS2, can prevent dry AMD from advancing further. The main form of treatment for wet AMD is getting injections into the back of the eye. That really doesn't sound fun, but I'd prefer that over losing spots of my vision. These injections slow down the leakage into the retina and prevent the damage from getting any worse. A combination of laser treatments and eye injections, called photodynamic therapy, is another treatment option that you can discuss with your eye doctor. This destroys some of those blood vessels in your eyes. However, there's not a treatment for the end stages of dry AMD, where the retina has atrophied. All of this may have sounded pretty scary, but there are some simple things you can do to prevent AMD. Tip number 1, you can take those same eye vitamins labeled AREDS2 that I mentioned earlier. Studies have shown that this can also reduce your risk of AMD, but talking to your eye doctor first to form the best plan for you is the best place to start. Tip number 2, eating healthy. Leafy green veggies, and just more veggies in general, have been shown to reduce the likelihood of AMD, and basically every other health condition too. Eating fish has also been shown to promote eye health and prevent AMD. Tip number 3, stop smoking. Lots of studies have linked smoking cigarettes with AMD, cataracts, glaucoma, and dry eye syndrome. If you think you may be having symptoms of AMD, like increasingly blurred or distorted vision, please see your eye doctor to get to the bottom of it and make the best plan to keep you seeing clearly. Click to watch my video about cataracts, which beats out AMD by being the leading cause of blindness in the world.